Hi, this is Dr. Brian Fullem with another Fullem fitness tip here at Elite Sports Podiatry. And today I want to talk a little bit about Achilles tendonitis. And to start out with, after you've had an injury or pain in your Achilles for more than a couple of weeks, it's no longer considered an itis. Itis means inflammation. And there was a paper that was published probably about 20 years ago from Scandinavia where people that had Achilles tendon ruptures, they took biopsies and looked for inflammatory cells. In the area where the rupture was, there was almost no inflammatory cells. So that led to the conclusion that it's not itis, it's actually osis. So one of the things that happens with Achilles tendonitis over time is the tendon actually starts to degenerate. So my advice for treatment of Achilles tendonitis revolves more around strengthening. So stretching certainly can help, but people don't injure their Achilles tendon because it's tight. People's Achilles tend to get injured because of a lot of different reasons. It can be from weakness of your core muscles. It can be how your foot functions. It can be a training error. But the majority of the time, when you have it for a long period of time, there's very few treatments that are going to work very well. And what will happen is you take time off, and if you don't do any treatment, your Achilles feels better, but as soon as you start running again, that Achilles pain comes back. So in addition to strengthening and stretching, one of the treatments that I found that works extremely well is the shockwave therapy. So two different types of shockwave devices, there's radial and there's focused, but there was one study that was done on radial machines by Dr. Amal Saxena in California, and he had over 20 athletes with Achilles tendonitis pain. And what he found was that almost 80% of those athletes were completely pain-free after 3 treatments with shockwave therapy. So it's a device that typically is promoted for use with plantar fasciitis or pain in the bottom of the heel. But in my practice, I try to use it on as many areas as possible because there's no downside to it. It can't damage the tissue, and it's regenerative. It helps the body produce new blood vessels, which will help heal that degeneration of the tendon or that tendinosis and get you back running sooner. This is Dr. Brian Fullem, Elite Sports Podiatry.